तो हेलो फ्रेंड्स, टुडे वी विल टॉक अबाउट थायराइड ग्लैंड। तो आज हम बात करेंगे थायराइड ग्लैंड। कल हमने डिस्कस किया था एंटीरियर पिट्यूटरी ग्लैंड। ओके, एंटीरियर पिट्यूटरी ग्लैंड बहुत सारे हार्मोन्स को रिलीज करता है बाय द ऑर्डर ऑफ हाइपोथैलेमस। व्हाट आर दोज हार्मोन्स? ग्रोथ हार्मोन, ओके, थायराइड स्टिमुलेटिंग हार्मोन, एडिनो कॉर्टिकोट्रोपिक हार्मोन, प्रोलैक्टिन, follicle stimulating hormone, luteinizing hormone. Okay, so they are the important hormones which are released by anterior pituitary gland. Yesterday we talked about those things. Today we will talk about thyroid gland in detail. So basically, the thyroid gland is situated around the throat region. So you can see that this is the uh, head, neck. Okay, here we have the windpipe, trachea. So this is the larynx, okay, larynx and pharynx. So below the larynx and pharynx, we have thyroid gland in between trachea. Okay, so this is the thyroid and parathyroid glands. So let's see the functions of those things. So thyroid gland जो है आपको कहाँ पे सिचुएटेड है? लैरिंग्स और pharynx के नीचे हिस्से में, पोस्टीरियरली, ठीक है। और आपके जो विंड पाइप है, ट्रेकिया है, उसके ऊपर आपको देखने को मिलता है। ओके, front end side of the trachea, just below the larynx. Okay, the two lobes are connected by a middle piece called isthmus. The structural units of thyroid gland are thyroid follicles, which produce thyroxine and trio triiodothyronine T3. Okay, so basically, let's see the location as well as detail. Okay, so this is the thyroid gland. Okay, this is the thyroid gland. This is the trachea. Okay, this is the thyroid cartilage. Okay, this is the butterfly shape. Okay, butterfly shape, these are the wings. Okay, so basically, so those are two lobes, you can see. This is the two lobes. Okay, first lobe and second lobe, a righter lobe and lefter lobe. Between that there is isthmus. Okay, we have isthmus which connect two lobes. This is very very important. Okay, so this is the righter lobe and left lobe, it is connected with isthmus. So this is the trachea, this is the thyroid cartilage. So above on the thyroid cartilage, we have butterfly shape like structured gland, that is thyroid. So you can see that this is the thyroid gland. Okay. So pituitary gland will release thyroid stimulating hormone. Then only the thyroid gland releases T3, T4, calcitonin. Okay. Let's talk about in detail. So the structural units of thyroid gland are thyroid follicles. So basically, if you uh, see structural, what are the structures? What are the cells? That is follicles. Follicles are the structural things present in the thyroid gland. Okay, you can see here. Okay, okay, you can see that these are the follicles. Okay, there is the one nodule on that. So biopsy are doing, but needle biopsy is that. Okay, you can see in detail. This is the front view. Left lobe, right lobe, parathyroid gland also attached. This is the trachea, thyroid gland, and larynx. Okay, let's talk about it in detail. So we have two things here given, that is thyroxine and triiodothyronine. Triiodothyronine and thyroxine. T4 basically the basic name is T3. Iodine. Okay, iodine means salt. And a salt, iodine salt, okay, is necessary for the synthesis of these hormones. Thyroxine contains 4 atoms of iodine. T3 contains 3 atoms of iodine. So basically, why we call T3 and T4? Here is the answer. Because it have iodine atoms. Okay, we studied about atoms. Okay, all those things in chemical introduction, chemistry of chemical. Okay, so basically here what we call T3 and T4. So T3 having 3 atoms of iodine and T4 have 4 atoms of iodine. So basically we need iodine for synthesis. तो यहाँ पे बताया जा रहा है कि जो सेल्स है उसको हम क्या कहेंगे, जो ग्लैंड है, ग्लैंड का जो स्ट्रक्चर हम देखेंगे, एक सिंगल यूनिट को निकाल के देखेंगे तो उसका नाम दिया गया फॉलिकल्स, थायराइड फॉलिकल्स। अब वो क्या करते हैं, उसके अंदर से अपने प्रोडक्शन करते हैं, अपना जो प्रोडक्ट है वो प्रोडक्ट का नाम क्या दिया गया, T3 T4। T4 थायरोक्सिन को कहते हैं और T3 आपको ट्राई ओडोथायरोडिन कहते हैं। ठीक है, अब ये बनने के लिए मदद कौन करेगा, आयोडीन। आयोडीन अगर होगा, आयोडीन क्या है, ये मटेरियल है। मटेरियल जब जाके मिक्स होगा तो उसका रिजल्ट क्या है, T3 T4 है। ठीक है, ये थायराइड ग्लैंड क्या है, फैक्ट्री। तो इस तरह समझने से आसानी होगी हमें कि हमें जो लास्ट एंड प्रोडक्ट मिलेगा उसको कहते हैं T3 एंड T4। अब हम अगर और डीप में जाना चाहते तो T3 में कितने हैं, 3 आयोडीन है। T4 में कितने हैं, 4 आयोडीन है। ओके, सो दिस इज द डिटेल। द थर्ड हार्मोन produced by the thyroid gland is calcitonin, which is secreted by parafollicular cells. Its function is very different from those of thyroxine and T3, which you may recall from chapter 6. सो ऑलरेडी कैल्सिटोनिन के बारे में थोड़ा हम लोग डिस्कस किया था। ठीक है, फिर हम आगे डिस्कस करेंगे T3 T4 पढ़ने के बाद। ओके, सो बेसिकली कैल्सिटोनिन भी आपको एक प्रोडक्ट है, ये भी थायराइड ग्लैंड के एक थोड़ा एक अलग, सो विल डिस्कस विथ, तो अलग सेल्स उसको बनाते हैं। ठीक है, और इसका फंक्शन भी अलग है। ओके, सो सो T3 T4, now we will talk about T3 and T4. So basically thyroid gland. So thyroid gland, we know it is a which produce hormone. Okay, it is situated at below the trachea, front and below the larynx. Okay, and it have two lobes. Okay, right and left. So it is connected by isthmus. Right and left lobe is connected by isthmus. Okay, and the smallest unit of thyroid is called thyroid follicles. So what will it produce? It produce T4 and T3. So basically it needs iodine for production of T3 and T4. Okay, so basically T3 and T4 having 3 atoms of iodine in T3, in T4 they have 4 atoms of iodine. Okay, so and another product it is produced by the thyroid gland, it is calcitonin. Okay, so it is different from T3 and T4. First we will talk about thyroxine and T3. Thyroxine and T3 have the same functions: regulation of energy production and protein synthesis, which contribute to growth of the body and to normal body function throughout life. Thyroxine and T3 increase cell respiration of all food types, carbohydrates, fats, and excess amino acids, and thereby increase energy and heat production. They also increase the rate of protein synthesis within cells. Normal production of thyroxine and T3 is essential for physical growth, normal mental development, and maturation of the reproductive system. These hormones are the most important day-to-day regulators of metabolic rate. These activities reflected in the functioning of the brain, muscles, heart, and virtually all other organs. Although thyroxine and T3 are not vital hormones in that they are not crucial to survive, their absence greatly damages physical and mental growth and abilities. Okay, so basically, why we need T3 and T4? So basically, whatever we eat, whatever we intake food, so it will convert into energy. The cell utilize it. So that is the main goal of every hormone. Whatever hormone it is releasing, so its main goal is development of the body, functioning of the body, and the function of organs. Okay, survival of the life. Okay, you have to go to survive the life. You have to finish your things, okay, and you survive your life. Basically कोई भी हार्मोन रिलीज होने का मकसद यही है कि जो भी आप खा रहे हैं उसको कन्वर्ट करना है एनर्जी में, और सेल उसको यूटिलाइज करना है, और सेल एट लास्ट एंड प्रोडक्ट देना है। ओके, so this is the main goal of every hormone. So along that we have T3 and T4. Okay, so T3 and T4 have the same function for production of energy. Whatever you're eating, it converted into carbohydrates, fats, or amino acids. So after that, it will reach to the cell in smaller amount. So cell will what to do? Cell you have to utilize it. So what the T3 and T4 do? It will increase the cell respiration. Cell respiration we talked in earlier classes. Okay, how the cell respiration occurs. So basically, the T3 and T4 hormone is helpful for cell respiration. This is the basic function of, because without cell respiration, okay, the energy is not converted and not utilized by the cell. So basically, T3 and T4 for development, T3 and T4 for physical growth, T3 is T4 for maturation of reproductive system. So if what will happen if the T3, T4 is absent, or excess T3, T4 is utilizing, so what will happen? Cell production, cell energy production will increase if T3, T4 is increasing. If T3, T4 is decreasing, what will happen? The cell production, energy production is decreased. Okay, so likewise, we have to think whenever a patient of hypothyroid and hyperthyroid will come to your clinic. Okay, hypothyroid means the function of thyroid is not up to the mark. T3, T4 are not working. Thyroid is not releasing T3, T4 hormone. So what will happen? Cell will get less energy. So you need more food. You ate more food. You sleep more. Your weight will gain more. Okay, and what will happen? Some uh, ladies will get hair, unwanted hair, and hair fall is seen because they are not getting nourishment, they are not getting energy. Okay, so there's the reason. So it is a basic function of thyroxine and T3. Secretion of thyroxine and T3 is stimulated by the thyroid stimulating hormone. We know that the pituitary gland is that the pituitary gland release TSH. So TSH, okay, TSH, after the releasing of TSH only, okay, thyroid will release thyroid glands. Okay, when the metabolic rate decreases, this change is detected by the hypothalamus, which secretes thyrotropin releasing hormone (TRH). Stimulate the anterior pituitary gland to secrete TSH, which stimulates the thyroid to release thyroxine and T3, which raise the metabolic rate by increasing energy production. The negative feedback mechanism then shuts off TRH from the hypothalamus until the metabolic decreases again. So basically, how it works? Basically, we have uh, hypothalamus. This is hypothalamus, pituitary gland. Okay, and we have thyroid gland. So hypothalamus, if the metabolic rate decreases, means the energy production is decreased. So the we have receptors all are going on the uh, blood. They are traveling in the blood. They will absorb. So here the metabolic rate is decreased. So what we have to do? We have to increase the metabolic rate. We have to increase the energy production. What it will send the information to the hypothalamus. So hypothalamus suddenly increase send the TRH. Okay, thyrotropin releasing hormone. Okay, it will release thyrotropin releasing hormone. So thyrotropin releasing hormone stimulate pituitary gland. Pituitary gland will release TSH. So TSH, after seeing TSH, thyroid will release T3 and T4. So likewise, it will work. So that's the reason if the metabolic rate decreases, it will reach to the information to the hypothalamus. If metabolic rate increases more than that, it will stop releasing TRH. So there's the thyroid will work. Next we have calcitonin. So what the calcitonin work? Calcitonin decreases the reabsorption of calcium and phosphate from the bones to the blood, thereby lowering blood levels of these minerals. These functions of calcitonin help maintain normal blood levels of calcium and phosphate and also help maintain a stable, strong bone matrix. It is believed that calcitonin exerts its most important effects during childhood. When bones are growing, a form of calcitonin obtained from salmon is used to help treat osteoporosis. The stimulus for secretion of calcitonin is hypercalcemia, that is high blood calcium level. When blood calcium is high, calcitonin ensures that no more calcium will be removed from bones until there is real need for more calcium in the blood. Okay, so calcitonin, what it will do if the in the blood level the calcium and phosphate level are decreased, so what will do, it will reabsorb from the blood, from the bones to the blood. Okay, if the minerals, these mineral calcium and phosphate are decreased, so it will reabsorb from the bone. Okay, so that's your normal calcium and phosphate levels are seen in the blood. Okay, so if the more calcitonin is there, so what will happen, it will more reabsorb. Okay, hyper level of calcium is seen in the blood. Okay, and there is the bones in density will decrease, so some patient will develop osteoporosis. So here one thing is also given that with the help of fish, salmon fish, you can treat osteoporosis. Okay, so this is all, this is about calcitonin. So here we have the diagram. Diagrammatically it is representing TSH, sorry, thyroid gland. Thyroid gland releasing T4 and T3 and increasing protein synthesis, increasing cell respiration. So glucose, fats, amino acids, all these will convert into ATP. Increase protein synthesis, also increase ATP. So all this will work for bone and muscle development, for liver metabolism, for brain development, mentally improvement, for reproductive organs, for hormonal balancing, and all those cycles which are happening in the reproductive organs. So this is about thyroid gland. So thyroid releasing T3 and T4, calcitonin. These are the functions, and regulation by TSH and hypercalcemia. Okay, so this is all about today. Tomorrow we'll discuss about parathyroid and other glands.